Hello everyone, and welcome to this edition of MSBA's Open Session program. And on this edition of the program, we're going to be focusing on the good work of school nurses throughout the state of Missouri. And joining us on this program is the director of the Missouri Association of School Nurses, Linda Newman. And Linda, thanks a lot for being with us.
Thank you.
Linda, school nurses throughout the state of Missouri provide such an essential service to our kids, keeping them healthy so they can continue their education. And that's especially true in this environment that we're in right now with COVID-19. Tell us a little bit about the role of school nurses throughout Missouri now and the additional responsibilities that they're taking on right now.
Sure. Well, again, as folks in education know, school nurses are the ones that bridge healthcare to education. And in our role, we manage chronic health conditions such as asthma and diabetes, seizure disorders, severe food allergies, all in an effort to try to keep kids in their seats in school so that they are able to learn. COVID-19 has taken quite a toll on the social emotional aspect of a lot of our children. And so that's one of our priorities. It'll be to be alert, particularly alert to kids as they come in with stomach aches and headaches, to try to get to the bottom of it, to find out whether it's actually anxiety or depression over loss of a loved one, or worries about a loved one. Also, the school nurses will be testing for COVID if their school districts approve that. That's up to the individual school districts. That'll be very time consuming in addition to their other roles during COVID, where school nurses will be doing daily assessments for children that become symptomatic at school as well as staff. They're also helping the health department right now in contact tracing, which is also quite time consuming. So, you know, we want to give the most attention we can to our children. And so it's going to be a real balancing act.
Besides the health issues, Linda, you were mentioning the social and emotional needs of kids, and that, as you said, is a huge issue. You don't really necessarily think of school nurses handling that side of things, but they see those issues, don't they?
Absolutely. A lot of times we're the first person that sees those social emotional issues when the children keep asking to come to the school nurse. What could seem like a simple headache or stomach ache to, you know, a teacher or another staff member, as the school nurse is able to see them one-on-one and kind of, you know, start conversation and build trust, you often find other things that are going on at home. Maybe mom or dad have lost their job and there's increased stress at home. Maybe grandmother who lived in the home with them has passed away from COVID. There are just so many different factors right now.
And Linda, this, of course, it's a rapidly changing situation, and it varies a lot from community to community. I presume school nurses are staying in contact with their local public health agencies and other health experts to try to stay on top of what's going on in their community. Is that right?
Absolutely. There were a group of school nurse leaders that have met with public health departments and the state health departments all summer long. And so that's been an interesting process, and we've learned along with the doctors and public health about this novel virus. And we'll continue to work with them on a daily basis.
Linda, you mentioned a little earlier testing, and of course the state now is making some rapid test kits available to school districts. Of course, it's up to the local school district if they want to participate in that or not, but in those districts that do participate in some of this rapid testing, I presume the school nurse is going to be involved in that. Is that right?
Oh, absolutely. The school nurse will be the designated person to do that testing. So, you know, like I said, it's going to be a real balancing act for those school nurses trying to do their regular job with children and then also screen for COVID, making those phone calls, doing the contact tracing, which contact tracing is quite time involved, and we don't want to take away from that time that we have with the children. So adding the testing is in theory a really good thing, and hopefully it works out. School nurses always find a way to make it work, but it will definitely add to their day.
Yeah. So on the contact tracing, Linda, how do school nurses do that? How are they involved in that?
Well, the school nurses literally have to, if a child is COVID positive, then the school nurse needs to find out what class the child's been in, who they've been around, if they've been around anyone for more than 15 minutes, less than 6 feet away, and those are potential contacts. And so it involves a lot of phone calling and a lot of collaboration. So it's a very time-consuming task to do. So we, spend a lot of time with the local health department and then with parents.
Linda, what about the students who are learning remotely, virtually at home right now? How do school nurses are they attempting to stay in contact with those students and help them with any health needs that they have?
Absolutely. I can't speak for all school nurses, but I know a lot of the school nurses that belong to the Missouri Association of School Nurses have contacted us during the summer and let us know some of the activities that they've been involved in over the summer and have continued into this school year as virtual and hybrid learning are going on. And those have been things like helping coordinate the meal deliveries, and some of the nurses have ridden the school bus just so that they can make contact with some of our high needs kids. Some of the nurses have actually made, porch visits where they can visit some of our high needs families. They make a lot of phone calls to stay in touch with our kids that have social emotional needs that we've known about prior to COVID.
We've heard a lot, Linda, about the importance of getting flu shots this year. In addition,
Absolutely.
In the environment that we're in right now, and our school nurses encouraging families to get their flu shots.
Absolutely. The last thing we need is an outbreak of a big season of flu along with COVID. A virus is a virus and it doesn't stand alone. You can get a cold and the flu and COVID at the same time. So they're all separate viruses. So, encouraging flu vaccine is really on the forefront of our mind. And we always encourage our staff and students to do this, but I think there's an extra effort to do that this year to help ensure that our kids stay healthy and safe and ready to learn.
What about the health of the school nurses themselves, Linda? What are they doing to protect themselves in this environment?
Well, it's been very difficult to get PPE, as you know, whether you're in the hospital or in the school setting, but we're doing our best to, acquire PPE so that we can keep ourselves safe. Another thing that our association, has been trying to do is to encourage self-care. It's very important to also keep in mind that, we need to take those mental breaks every day and try to take care of ourselves as well. Because if we're not there, then who's going to take care of the students?
What do you see, Linda, as the major challenges moving from this point forward in this environment where we're still dealing with COVID-19?
I think the major challenges are, just keeping our kids healthy and making sure that people stay diligent and that they wear their masks, that they wash their hands frequently, that they continue to social distance. It is a concern as we see things opening back up. We understand that it's so important for the economy to open up and be strong, but we can do this and still be smart about it. So, just that message of continue to try to use those personal mitigation measures.
Well, our school nurses are doing yeoman's work out there, Linda, and please pass along our appreciation to all of them across the state for being on the front line and keeping our kids safe. We certainly appreciate all their efforts and appreciate you being with us today on this edition of MSBA's Open Session. Thanks a lot, Linda. We appreciate it.
Thank you for your time.